All right, welcome to the Radical Independent. My name is Dave. I'm not sure if this video will stay up on YouTube, but it will be available on Rockfin and over on Odyssey. So, amid the raging opioid crisis in the United States, in line with a 2021 settlement with three of the largest drug distributors in America, limits are currently in effect that sometimes block pharmacies' orders of controlled substances such as Adderall and Xanax in cases where they exceed a specific threshold. Individuals struggling with insomnia, anxiety, and attention disorders are having a hard time getting hold of their prescribed medications due to a secret pharmacy order limit, U.S. media outlets have reported. In effect, patients with legitimate needs to use controlled substances have fallen victim to the crackdown on opioids. The United States has been in the grips of a deadly national opioid epidemic. Amid the heightened scrutiny, an agreement was reached last year between the attorneys general of 46 states and three major drug distributors, Cardinal Health, McKesson Corporation, and Amerisource Bergen Corporation. New requirements are now in place for companies that provide medications to pharmacies. The $21 billion settlement was tailored to correct previous practices that resulted in the U.S. being inundated with prescription painkillers, something that fed into the nation's opioid crisis. Now, distributors set strict limits on drug supplies to individual pharmacies as algorithms are used to cap the quantities of controlled substances a certain pharmacy can sell in a month. It has affected the ability to dispense medication to patients with legitimate medical needs. Lisa Bernstein, chief executive of the American Pharmacists Association, says it's disrupting patient care. I understand the intention of this policy is to have control of controlled substances so they don't get abused, but it's not working. There's no reason I should be cut off from ordering these products to dispense to my legitimate patients that need it. This comes from Richard Glotzer, an independent pharmacist in Millwood, New York. The U.S. media report did not clarify whether the cap was having a similarly disruptive effect on major chain pharmacies. Irresponsible drug company marketing and prescribing have been blamed for the opioid crisis, triggering lawsuits and a move to install tighter regulations on aspects of the health system. The overall number of general drug overdose deaths has skyrocketed in the United States, with 107,375 people dying in the country due to drug overdoses and drug poisoning in 2021. The Centers for Disease Control specifically noted that illicitly made fentanyl have played a considerable role in the surge in drug-related deaths, with only 3,105 synthetic opioid overdose deaths reported in 2013. The number reached 36,359 in 2019, and then 56,516, and then 70,601 deaths reported, respectively, in 2020 and 2021. So the opioid crisis being fueled by illegal opioids and overprescription has now caused an opioid crisis in a different way, a shortage, since you've got all these people now addicted to all of this medication. They can't get their medication. Some of them, I'm sure, are legitimate, but I'm sure because of our drug culture here in the United States, prescription and otherwise, it appears that people are really going to be having withdrawals out there. And some people may end up not making it because they can't get the drugs that they've been prescribed for a very long time. So that's this little report. I figured I'd get out there to you via podcast format. Thanks for listening, and I'll be back soon.